Hey everybody, it's Dr. Steve Fleischer at Everybody's Chiropractic and Wellness in King of Prussia, and today we're going to continue talking about degeneration to the spine. It's commonly known as osteoarthritis, degenerative arthritis, lipping, spurring, calcium deposits. They all mean the same thing, and it's due to abnormal wear and tear on the spine and the discs. So if you recall, when you look at a spine from straight on, it's supposed to be perfectly straight. From the side, there's supposed to be three normal curves. When you have this normal alignment, there's minimal wear and tear to the spine, and your spine will last you as long as you live. But due to stress, poor posture, poor eating and sleeping habits, traumas, things like slips, falls, car accidents, and even playing sports will all cause the vertebrae of the spine to go out of alignment. It'll cause reduced motion, and it'll cause extra stress to those bones that they're normally not meant to deal with. So, if you were to look at a normal model of the spine, this represents any two vertebrae in the disc. So these are the bodies, this is the disc, this is the spinal cord with the nerves that go to every single organ, tissue, and cell of the body, and these are the spinous processes that you see when someone has their shirt off down their back. So when these vertebrae are all lined up and moving freely, everything's going to work fine. But due to lack of maintenance and the things we talked about before, the vertebrae of the spine will shift out of alignment and it'll lose some motion. So not only does it put pressure on the nerves and cause diminished health, which we'll talk about in a different video, but for this purpose, we're going to talk about how it affects the bones and the discs. So the bone goes out of alignment and it loses some motion. So the force of gravity is distributed differently. The body tries to heal itself. It puts more calcium down on the bones where the additional areas of stress are to make them stronger. Also, the disc is 90% fluid. After the age of 12, there's no longer any direct fluid supply to the disc to keep it hydrated. So, the disc stays hydrated by the vertebrae moving on the disc, creating a pumping action. It squeezes fluid out and draws new fluid in. The disc will stay healthy as long as this is at 100% efficiency. But when the vertebrae go out of alignment, part of the motion is lost, so part of this pumping action is decreased. So over time, the disc doesn't get the fluid it needs any longer, and it begins to dehydrate or degenerate. It begins to shrink up. The rings of the disc become brittle, and it allows for the jelly-like mass in the center of the disc to start to ooze out. This is what we call disc bulging, disc herniation, disc prolapse. And we'll talk about that in a different video as well, but for the purposes of this, we're just going to stick to the arthritis, the degenerative change. So, this is a model of a normal disc and vertebrae. The bones are nice and square and smooth. The disc spaces are even throughout. When the vertebrae goes out of alignment, we call that a subluxation. The stress increases on the bone, and microscopically, there's extra calcium being laid down on the vertebrae. The pumping action diminishes, and the disc begins to dehydrate on a very small level. But if this goes on for 15 years or so, we begin to see signs of degenerative changes. We begin to see some spurring on the bones. We begin to see thinner disc spaces. And by the way, it also causes more pressure to the nerves. There's less motion, it causes more problems. If this isn't corrected, then it moves down the chart, like I said in the previous video, to phase 4, where we have fusion, permanent damage, a very poor quality of life. So I like to use an analogy about cars. I'm into cars, and cars are subject to the same laws of gravity that your spine is. So, we do maintenance for our cars. We change the oil, we change the fluids, we make sure that we rotate and balance the tires, and we also align the front end of the car. Because when we're driving down these roads, especially these Pennsylvania roads, we hit a pothole, and potholes will cause your front end of your car to go out of alignment. When this happens, the force of gravity is distributed on the tires. And if you keep driving on those tires with the front end that's out of alignment, we begin to have abnormal wear and tear on certain sections of the tire that are in greater contact with the ground due to the misalignment of the front end. So if you allow this to continue, you'll see more damage to the tires, which is wear and tear, which is what degenerative arthritis is. But on other parts of the tire, you'll see that it'll look brand new. Now, if you go too far, this damage will be so bad on your tire that you'll need to replace the tire. Unfortunately, you can't replace the spine. So the important thing is to make sure you know what your spine looks like. If you already have arthritis, you know it's bad. Now people say, well, you know, arthritis, it's due to old age. It's not due to old age, and I'll prove it to you. I've seen patients that are in their 30s that have degenerative change in their spines. They've got arthritis. I've seen people in their 50s and 60s that have minimal to no arthritis. And if you need further proof, let's look at this picture right here. This x-ray. We're at a phase 2 degeneration. You see down here there's thinning of the disc spaces and there's spurring on the bones. This process has been going on for at least 15, if not 20 years or longer. But if you look at the top here, the bones are nice and square and smooth. The disc spaces are even. This looks like the neck of a 20-year-old person. Down here, we're looking at the neck of a 75-year-old person. Now, these bones here are just as old as these bones up top. So it can't be due to old age, because if it was, you would expect to see this arthritis throughout the entire spine. So if you think you have arthritis, or you've been told you have arthritis, it's time to get your spine checked by a chiropractor, because we'll let you know where the damage is, and we'll let you know how much of it we can fix. Give the office a call at 610-337-3700, and let's make your spine last as long as it's supposed to. Take care.